Before we go any further, likely the most important job I have while presenting this course is to teach you that the listening and spoken language approach through LSL intervention, auditory-verbal therapy, is all about the concept of auditory first. In AVT, auditory-verbal therapy, the child does not sit face-to-face with the adult. Rather, we sit to the side of the child. In AVT, the child does not watch our lips, tongue, mouth for cues for producing speech. Rather, we use techniques to make the speech sounds easier to hear and produce through listening alone as much as possible. Each band of speech information is color-coded on the rainbow audiogram and labeled to show the frequency ranges where those speech features are heard. When we analyze the speech perception and oftentimes production errors of children, we discover what portions of the speech spectrum they're not hearing. We would then partner, as said before, with the managing audiologist to help pinpoint where the child is not hearing optimally and have adjustments made to their hearing technology. So, if I hear a child with vowel errors, I am wondering about their hearing technology access between approximately 1,000 and 3,000 hertz. If a child is making errors in place of production, for instance, they're saying spoon for spoon or pan for can, I am going to ask the audiologist to please check out the child's hearing and hearing technology access between 1,500 and 4,000 hertz. A critical point when we are working with this population and trying to close gaps in development. Babies and toddlers and very young children are aging at the same time that we are trying to catch them up. We must know how much progress we need to make in a certain amount of time by targeting the right goals. During the time period when the videos of Hudson you're seeing were being recorded, I was zeroed in on getting him completely caught up by his 4th birthday. How did I do this? I looked at each skill area from his evaluation as well as his treatment notes to analyze what skills he had mastered, what skills were emerging, and what skills were absent. I will note here, you can follow your clinic or school or Medicaid guidelines to determine how often you need to do a reevaluation and perform formal testing, but reevaluation should absolutely occur at least every 12 months, if not 6 months. And even with those timelines, your therapy data is always going to be diagnostic in nature so that you know before, during, and after every session how your patient with hearing loss is functioning for each skill domain. So I did a little old school kind of covering because I see him really watching my mouth and I want to make sure he's hearing he versus she, and she is visible. You can really see she. So that's why I just did a little kind of redirect or don't look at my face and got back behind him so that we're not having to do a natural kind of covering of the mouth. Be a superhero.
Oh! I think hers is brother.
Brother is he. That's right. He wants to be a superhero.
I want to be the pants.
Very good job. And that's right. He wants to be a superhero. Mm. Great job.
Put shoes on.
Yes.
That's right.
Shoes on.
Okay, very good.
What? This one?
Yeah, that's the other
shoe.
And then this is his mask. I usually try, we can get some exploration of him and his and all that, but kind of I work at one concept.
I love it.
You did? So that means that she wants to be a firefighter.
Yeah. Oh. Be a firefighter.
Mm-hmm. She is going to be a firefighter.
Oh, it's my one to try.
She is. Yeah, she is. Good job. She is a firefighter.
Yeah.
Who's a firefighter?
Just
That's an open-ended question. I'm going to check for maybe a little bit of delayed imitation to see if it's not direct. It's not like, say she. That doesn't help him at all. He's got to start to figure this out on his own. So I'm open-ended question. Who?
it's one big shoot at a fire.
Yeah. And it's kind of cool that we're working on pronouns right now, too, because we can play a little bit with having him answer the question also.
Mom's digging.
Of kind of like boy and girl to sort of solidify it. So we can layer on the question, whose mask is that?
That's boy.
Oh, good. I'll have Mommy answer. Listen, Mommy, whose mask is this?
That's his mask.
That's his mask.
So this is me in the diagnostic therapy mode, meaning I'm thinking about what goes along with this that he also needs to know, that's very applicable to extend his knowledge and also to give mom another idea for really meaningfully working through pronouns.